one very important point to cover when you make a decision how to treat patients with ALK-fused non-small cell lung cancer who are newly diagnosed is to point out that chemoimmunotherapy would not be an appropriate choice for those patients. None of our trials which look at efficacy of carboplatin, pemetrexed, pembrolizumab in stage 4 newly diagnosed non-small cell lung cancer, such as KEYNOTE-21G and KEYNOTE-189, were allowing patients with either EGFR or ALK inhibition. So we truly have no evidence that addition of immunotherapy to chemotherapy or immunotherapy by itself, such as KEYNOTE-024 or KEYNOTE-042, has efficacy in patients with ALK mutant non-small cell lung cancer. So I definitely would not recommend using monotherapy immunotherapy as a first-line treatment option in your patients with ALK-fused non-small cell lung cancer. Neither will I recommend using chemotherapy plus immunotherapy in those populations, just because those patients were not included in the trials. The only immunotherapy trial which used combination of immunotherapy plus chemotherapy that allowed ALK-fused patients was a trial called IMpower 150. In that trial, only patients who have been exposed and failed all the appropriate ALK tyrosine kinase inhibitors were enrolled. So for your patients who is newly diagnosed, who you're making a decision what to do, if you know that your patient have an ALK mutation, ALK tyrosine kinase inhibitors would be the most appropriate choice. We have looked at efficacy of monotherapy PD-1 inhibitors in patients with ALK mutant non-small cell lung cancer, and the data so far is pretty inferior. There are several studies looking at either retrospective analysis or prospective analysis or subset analysis of efficacy of monotherapy PD-1 inhibitors in that patient populations. And there are studies that show that response rate is 0. There are some studies that show that response rate is pretty low in the single digits, like 9, maybe 10%. So outside of the clinical trial, I personally do not use monotherapy PD-L1 inhibition in ALK mutant non-small cell lung cancer unless I exhausted all my other options, meaning all ALK tyrosine kinase inhibitors that have efficacy, platinum doublet, and maybe monotherapy immunotherapy, and monotherapy chemotherapy before I consider PD-1 or PD-L1 inhibition as a single agent in that patient population.